Familial hypercholesterolemia is a genetic heart disease caused by inheriting a mutation in your genes. The mutations basically make your body unable to effectively remove low-density lipoproteins, aka LDL cholesterol, aka bad cholesterol buildup. High levels of low-density lipoproteins over time block arteries, which cause serious problems like heart attacks and strokes. This genetic problem is present from birth, and therefore the buildup results in these problems earlier in life than other heart diseases. The good news is this can be easily identified with the correct tests at any stage in life. Randox biochip multiplex technologies include accurate, rapid arrays of diagnostic tests for simultaneous detection of 40 gene mutations that can all cause familial hypercholesterolemia. Randox make it easy to test for these complex genetic markers comprehensively for accurate analysis of genetic mutations for FH, 40 mutations within the LDLR genes, ApoB, and PCSK9 gene types. Identification is key for correct care and preventing problems. Understanding your heart health with detailed measurements is now easier than ever before with Randox Health. Plus, personalized treatment can be tracked and tailored for your care. People with FH have much higher levels of both total cholesterol and LDL cholesterol from birth. Randox has one of the world's most extensive heart health testing panels, with about 20 more tests for heart health alone, including apolipoproteins A1, B, C, and lipoprotein small a. These are in addition to the genetic mutation tests. These are protein tests for the functional health of your heart on a daily basis, which prove truly useful when ruling out or ruling in the need for the genetic FH test mentioned. These protein tests should also be monitored routinely from Randox for everyone's heart health, including FH patients, because your data is like your instruction manual for keeping you healthy. Lipoprotein small a, or LP little a, is a particle that carries cholesterol in your blood. The same as LDL is a particle that also carries cholesterol. High LP small a levels are associated with higher risk of heart attacks, aortic stenosis, and possibly stroke. Individuals with familial hypercholesterolemia, FH, have higher LP small a levels than the general population, which are often seen to be exacerbated further by additional causes of high cholesterol like high blood pressure, obesity, and diabetes. LP small a is a great example of the test Randox manufacture and offer to the public through Randox Health. This is actually a unique protein test because the levels of LP small a are inherited too, similar to FH, not impacted by lifestyle factors, diet, exercise, but genetically influenced and now easy to measure with Randox. Firstly, the most important reason to check an LP small a level is to understand the biochemical composition of your heart health for overall risk management and assessment. The risk of a heart attack in those with high LP small a over 50 is 3 times higher than those with lower levels of LP small a. The second reason is for some people who test negative for the FH gene, they still have very high LP small a levels and are therefore still at risk of the same consequential health problems occurring unexpectedly. Therefore, let's test to prevent and protect our hearts. Randox Health see clearly these scientific diagnostic markers and patterns in children and adults alike, showing double the normal LDL cholesterol levels and a family history of early heart attacks are clear characteristics of the FH disease. If untreated, you are likely to develop coronary heart disease and suffer heart attacks early in midlife. Approximately 1 in every 3 to 500 people have FH, and up to 90% don't know they have it. Therefore, they don't get correct or timely treatment. Problems could be prevented, and treatment for high-risk individuals can be easily managed. If you identify the genetic disorder early on, this risk can be reduced by 80%, so you can prevent early onset heart problems. If one parent has FH, their child has a 50% chance of having FH too, and may develop cardiovascular disease prematurely at the age of 30 to 40. If both parents have FH genetic mutations, their child will have a far more serious, yet much more rare form of the disorder. Cholesterol control medication for people with FH is not the same as for those without the genetic mutations. Therefore, treatments must be tailored and tracking testing must be routine to monitor the condition and the response in the body. Randox Health offer all of these tests and more directly to the public for proactive and preventive health help. And everyone should get these tests for heart health, plus for all of our other important systems in our bodies to be assessed in detail from a small sample of blood at Randox Health every 6 months or so. With the world's most extensive well-being check available from Randox Health, it's designed by the experts at Randox to protect and preserve the health of your whole body. Randox knows everything is important and everything is interlinked. Everything is personalized to you. Everything can be measured in your blood, including your heart health, including familial hypercholesterolemia. Randox has the answers. Test everything. Establish your personalized health baseline, identify the earliest signs of illness, and optimize your results to prevent diseases developing. Think through your family history. Do you know if high cholesterol levels are common in your family? Have you or any of your family had extensive cholesterol panels tested on a regular basis for risk management or medications? Have any of your loved ones suffered from heart disease or a heart attack before their mid-60s in men or mid-70s in women? If so, FH is a possibility. And if you do have FH, then each of your close family members has a 50% chance of having FH too. This includes your parents, siblings, children, aunts, uncles, and cousins. This means that if you were diagnosed with FH, but don't know of anyone else in your family who has it, your whole family should get tested to be sure. More good news is that there are cascade screening protocols for this genetic disorder for every person identified with FH to be an index case and implement best practice family testing and tailored treatments, which are well known and proven to work well. A few additional visible signs to look out for when it comes to cornering FH would be yellow deposits of cholesterol-rich fat, which may be seen in various places on the body, such as around the eyelids or on the colored part of the eye, also building up in the tendons of the hands, knuckles, elbows, knees, and feet, particularly the Achilles tendon. These can be lumps or bumps and can also be swollen or sore. Accelerated deposition of cholesterol will likely cause chest pain or tightness as a precursor to heart attacks. There also is potential for the arteries of the brain to be affected by cholesterol deposits, and this may lead to transient ischemic attacks, TIAs, showing as brief episodes of weakness, usually on one side of the body or face or mouth, or the inability to talk, and these are often precursors to stroke. Someone that didn't have any visible symptoms, however, and didn't know they had FH, came to Randox Health recently. With the anniversary of his dad's death approaching and his own 42nd birthday nearing, he said he just wanted to be sure he could count on his health and to be sure there wasn't anything to be fearful of. He said that he felt great. I heard that he looked great. He worked out daily, actually cycled about 100 miles a week. He ate a very healthy, low-carb, low-red meat, low-sodium diet, but his health was shadowed by the fact that his dad died in his late 40s. And it was sudden, shocked the family without any real clear cause. So he came to Randox Health, chose the entry-level everyman package, and knowing that it's better to bring everything into the light, learn from your personal data points, and use it to win, as opposed to keeping your health in the dark. It was, as always, an uncomplicated, quick 30-minute appointment, blood samples taken, questionnaire completed. The next day, his Randox report was released with 165 test results with intelligent algorithms showing heightened risks of familial hypercholesterolemia, FH. From his 20 cholesterol and heart health measurements, recommending the genetic test for FH be approved. So he opted in for the genetic test to be performed on his blood sample at Randox Laboratories, and he had his private personalized consultation booked for the next day. He was positive. For Randox, he learned so much about his father's health and lifespan, plus how to best test and take care of his own body. With ease and education, everything was manageable. He gained control of his health and his family's health and his future in one fell swoop. With FH, cholesterol levels are generally not changeable through lifestyle factors like exercise or a healthy diet. The first line of treatment is cholesterol-lowering medication, usually a statin. This client was directly referred to a lipid consultant for treatment to bring his high cholesterol levels under control and reduce his risk of developing cardiovascular disease or damage to the arteries from the heart or to the brain. In this continuing case, we've actually just Randox health checked this man's daughter, whose results are showing signs of a heart condition called internal arterial stenosis. This is closely linked with elevated cholesterol and atherosclerosis, which is the accumulation of fatty material in the blood vessel walls. And so it is ongoing and it is all being optimized, so watch this space for more good news. And sign up for more information on many more health solutions with life-saving science from Randox. Thanks to Randox Health, personalized data analysis and tailored action plans, we can live healthier lives for longer with our loved ones looked after too.